Hi, I'm Alex, the People's RN, an ICU trauma nurse here to help you navigate your healthcare and the healthcare of your loved ones. Today we're going to talk about 9 remedies to help you combat COVID. We know that this is on the rise again, and these are 9 things that I implement with my family immediately when they start getting back to school and when I fear that they may contract COVID. Number 1 is vitamin C. Vitamin C is a huge immune system booster, and it's something that we take if I feel a little tickle on my throat, or I feel like we have possibly contracted COVID or the flu or a cold, or I know that it's going around. We use emergency C in my house, and what I do is I pour it in about 2 ounces of water in the morning and before bedtime, with a total of like 2,000 milligrams a day. My toddler usually won't drink emergency, even though it is safe to give to children because it's a water-soluble vitamin that whatever your body doesn't use, it urinates out. But I do give my toddler liquid vitamin C inside of his yogurt, about 500 milligrams a day when he's sick. So you wanna kind of see how much you're giving them. Vitamin C has been proven to help your white blood cells fight infection, and it helps with inflammation. The second remedy we're going to talk about is vitamin D. Vitamin D has been proven to be a huge benefactor in fighting COVID. And what studies are finding is that people who have high levels of vitamin D in their bloodstream are 77% less likely to produce like viral respiratory infections. They're finding that it's also helping reduce inflammations, and it's also helping in avoiding ARDS. In the ICU, we would see a lot of patients coming in with COVID pneumonia, which would then result in ARDS, which is acute respiratory distress syndrome. What ARDS is basically acute lung failure. Your lungs stop working, and we need to put you on ECMO and life-sustaining machines to help you keep you alive, and this can possibly lead to death. Studies are showing that patients who did end up getting ARDS have a significant deficiency of vitamin D in their bloodstream. So you want to get vitamin D in your bloodstream. Vitamin D also helps you absorb vitamin C. The recommended dose is about 600 IUs of vitamin D a day, and studies are finding that about 30 minutes of sunlight midday help you absorb anywhere from 10,000 to 20,000 IUs a day of vitamin D. You want to go out there and get vitamin D, guys. 40% of Americans have been found to be extremely deficient in vitamin D. The third remedy we're going to talk about is rest. I cannot emphasize the importance of rest. I have gotten so many patients that have contracted COVID and ended up in the ICU. They're doing fine at home, but then about 2 to 3 weeks after getting COVID, they're like, I'm fine, I'm over it. They start mowing the lawn, they start using household cleaners to clean their house, they start running errands, and they end up in the hospital unable to breathe. Rest to allow your cells to regenerate and fight any type of virus. Number 4 is hydration. I cannot emphasize the importance of hydration. We do not drink enough water. When we get patients into the ICU that are fighting septicemia, which is infection in the bloodstream, the first thing that we do is pump them with fluids. You need a lot of water for your liver and for your kidneys to flush out any viral or bacterial infections that you have going on. I'm going to add to that when you have COVID, you're not really going to have an appetite. So make sure to drink fruit smoothies and soups. Hydration also helps with fevers. In my household, we are not scared of fevers. Fevers are the body's way of fighting infection. It's the body's way of making the environment extremely uncomfortable for this infection and saying, hey, you don't belong here. You need to leave so that the infection doesn't grow and thrive. Fevers are good. I've let myself and my children and my patients have a fever of up to 103 if I see that, they're not shivering too bad, and I just give them supportive measures, which is ice packs, cold towels around the neck and the head, and even a lukewarm bath. Fevers are good. If you can keep a fever running as long as possible, As long as the patient is tolerating it, it will definitely reduce the lifespan of this infection in your body, okay? The fifth remedy we're going to talk about is fluticasone. Fluticasone is a corticosteroid that helps with inflammation. With COVID, you're going to probably have sinus infections and a lot of congestion. 2 sprays, like in each nostril in the morning and in the evening, really help with congestion. Speak to your pharmacist or to your doctor before taking this medication, just to make sure you're getting the right dosage and for how long you're supposed to take it, okay? The sixth remedy we're going to talk about is Vicks. COVID produces an extremely bad cough that is hard to control. Vicks really helps with this if you rub it against your neck, your chest, and your back, and the soles of your feet. The seventh remedy we're going to talk about is warm tea. Warm tea is something that I'm going to piggyback onto that cough. If you're finding that Vicks and medications don't help with the cough, warm tea has worked wonders. Any tea helps. Ginger, chamomile, black tea. I would suggest you add honey to that because honey really helps with the cough. And if you can add ginger to that, that's going to be a huge immunity booster, and it's also going to help with the cough. The eighth remedy we're going to talk about is garlic. Garlic has been proven to be an antibacterial, antifungal, and antiviral substance in the bloodstream, which also reduces inflammation. So put garlic in your food. The ninth remedy we're going to talk about are onions. Onions have an antioxidant called quercetin, which help you fight inflammation, and it's great for your immunity as well, guys. So add those onions to your food. If you found this video helpful, please like and subscribe. And if you have any questions, you can reach me at alexyourrn@gmail.com. Thank you and have a great day.